Centre. I'm here today having a socially distanced chat with our lovely complementary therapist, Sue Clarke.
Hi, so Sue, do you want to tell us a little bit about yourself?
Hi, my name is Sue Clarke. I've been working at Complementary for the last 5 years. I love doing complementary therapy.
So when you say complementary therapies, what does that involve?
So a complementary therapist would work hand in hand with a medical profession to help a patient.
Complementary therapy covers a wide range, doesn't it? I mean,
Yes.
You've qualified in a huge number of different things. First question is, what are those complementary therapies that you have studied and become qualified in?
Thank you. Well, about 35 years ago, I qualified in remedial massage, and then I went on to do aromatherapy massage, reflexology, and through my career I've done many different CPD days, and then I found myofascial release and craniosacral therapy, and those therapies became part of something more than just massage.
What do you mean by something more than just massage?
I found craniosacral therapy and myofascial release was, for me, the missing link. It's a link between the whole fabric of the body that's supported by muscles. So for me it became an important part of getting someone moving holistically and whole person. So I became very enthusiastic about that because I feel that, you know, when one part isn't working because it's stiff or, you know, in pain, then the rest of the body can become affected, and I found myofascial release and craniosacral therapy was something that could support me in helping somebody to get back to some movement or some sense of peace in their life.
I think one of the things I find really fascinating about the way you work is that you are very much not off the peg. So if a patient comes in and says, say they've had an operation and they've still got some pain and some anxiety around getting back to being as active as they were before, they might come in saying, I just think I'd like some reflexology.
Yeah.
But you have a slightly different approach to that, don't you? Do you want to tell me kind of how you would approach that patient?
Complementary therapy is very much about well-being for me. Then reflexology would be something that you start with, but maybe there's other things that could help them along the way cope with whatever they're going through.
So that's when you might bring in some of the other tools that you described before, your other therapies.
Yeah.
And what helps you decide which therapies would be right for that person?
Listening to the patient, understanding what their problem is, understanding how it's affecting them in their life. So, for example, if somebody has had a chronic illness of some sort, then reflexology can be the thing to get them back holistically to where they want to be and help them relax and sleep and feel better within themselves. Whereas myofascial release and massage may help the part that they've been operated on, so that they can get more freedom inside their body. So when that pain is no longer a reminder, then that helps people move on with their life, I've found in my experience. That's why working in Complementary is important to me, because sometimes you come up against things that you can't deal with, and things that aren't going to help somebody. So I would suggest we do 3 treatments, and then we see from there where they're at. If there's been an improvement, I like to mark, and monitor what the improvements they're experiencing as well as what I'm seeing. And then that helps me guide someone to the best possible outcome for themselves. Some people have a chronic condition, so therefore it's good for a patient to know that we would be here on a regular basis to keep them moving forward, so that they don't actually stop and slip back.
By chronic, you mean not that it's, it could be bad, but that's not an indication of severity, is it? That's a longevity thing.
Yeah.
So maybe someone who has, for instance, arthritis, that we can't cure the arthritis, but it's about trying to...
keeping them moving, keeping them moving, keeping them flowing, making sure that they're able to always meet their goals and what are their goals. So for example, if you've got somebody that has got a bad back and they love running or exercising and they haven't been able to do that, then I find that that can affect people in many ways. It can affect their ability to get on with their life because that's part of their stress management. So being able to keep somebody on track for that when they've got a condition in their back that's there, then we can be a support to them, and I find that's a part of the process that I love being involved in Cranfield.
When patients come in, one of the things that I found very interesting about the way you work is you say you listen to patients, and that's a very important part of learning how you would best help them. But also you look at them, don't you?
Yeah.
What are you looking for?
When a patient comes in, I'm listening, looking, and understanding how that pain or that person needs to be supported. So I'm looking for information, and I'm also looking to help them to understand that I understand what their pain means to them, because pain is personal and it's complex, and we can't experience what someone else is experiencing. So part of the process for me is understanding that person, because when somebody feels understood, they feel a relief in that, and I can actually see when somebody has offloaded their fear and anxiety and frustration of what's going on around them in their lives or within them, there is a change, and that's what I'm looking for.
And I think sometimes you've mentioned that a patient might unconsciously be physically guarding a part of their body, and that's something that you maybe look for too?
Yes, I do. I found that very much when I worked in a cancer hospital, and I found that post-treatment, obviously, there's an amount of guarding that people would have to certain areas that they had treated with invasive therapies. That's something that is interesting, because that can then be part of other pain in their body. So I can help somebody understand that actually it's okay to relax that part.
And it may be something that they're not
aware of.
Yeah.
I have had patients that I've treated, a few years on from breast cancer, lymph node cancer, that have still had problems in the fascia of the body, because that part has become a part that's automatically guarded. It's a human response to guard yourself and protect yourself. And I found that listening, also understanding and just showing somebody that there are other ways that they might be able to help themselves, and then they can choose to do that if they want to.
And I imagine that, say, you're treating someone who's gone through something like breast cancer maybe 5-10 years ago, if they've adapted the way they've moved as a result of that unconscious protecting, that things have, obviously that's had a physical change to their body. When you start to work on that, do you find that sometimes that unpicks some of the emotional legacy as well?
Yeah, very much so. Pain is personal. Someone's journey through cancer is very frightening, and helping somebody through that can sometimes surface emotions that they maybe didn't have at that particular time. I can think of experiences when you go into certain situations and you think that something has been dealt with many years ago, and you come into a situation that's reminiscent of that, then you can find that sometimes emotions can surface, and it's just allowing and understanding that that is part of a process of healing, and it's whole person, not just an arm that's not moving properly. There's a lot of pain and emotional context associated to that in some patients.
So can I ask you about sort of patients that you've seen and experiences you've had with treating them, so that we'll sort of get a concept of what you do and how you work with people?
Sure. A patient that springs to my mind presented with neck and shoulder pain, which was quite severe and causing them a lot of problems continuing with their work. So the physio treated the pain and got the shoulders and the neck moving, and that was really great. But the tension in their body kept coming back again. So one of the physios sent them to me to see what I could find fascially. And when we'd done some exploring and I met the patient and listened to them, what I found was that there was another part of the body that was contributing towards that, which was a postural position that they were sitting in because their job was very stressful. So we worked whole body on that person. So I worked the whole of the back and some of the hip. And what we found was when we worked with some of the back and the hip, that the neck area got better because it didn't keep coming back because the tension wasn't there in the body. And so that was a really successful case, because that person was getting frustrated with not being able to move past the shoulder, because when you're in pain all the time or something's there that's irritating you, it becomes the focus. So focusing on everything else that's going on in your life, particularly at the moment, everything that's going on in this world, that can become quite restricting. So to understand that there is more going on than just sometimes the pain that someone's presenting with is a big part of complementary therapy for me, and something very valuable that I learned when I was working at a cancer centre.
So you talk about fascia.
Yes.
Not everybody may know what fascia is, so can you explain what is fascia and where do we find it in us?
So fascia is connective tissue. How I visualise it is a bit like you're in a body stocking. That's how I would explain it. And it's a transport system for the body, it's a communication system for the body. There's fascia in everything inside the body.
So your lady that you were talking about who had the recurrent neck pain,
Yeah.
you said you worked on her back and hip. That may seem a bit wacky, mightn't it?
Yeah.
So is that because of fascia, or
Yeah.
what made you think about
Because of fascia.
that?
When I found where her fascial restrictions were, I found that there was one particular restriction in the lower part of her spine, and what that was doing was, because that lower part of her spine was really tight, it was hitching up her hip, which was actually affecting her movement in her shoulder. I show people how if you hold your clothes on your hip and try to move your arm will then become restrictive. So actually freeing that part of her back actually and her hip actually helped her feel more comfortable in her own posture, so therefore she was moving more freely.
And the techniques that you use to free up fascia, are they painful? Are they strong techniques?
No, very gentle techniques, because you match whatever it is that their body needs. And by that what I mean is you would only go in at the level that they could cope with the touch, but you're still going to get some movement, because it's very much about moving with the body than it is moving against it. Whereas massage can be a little bit deeper. Fascial work is more superficial because it helps release everything around the tissue, and so therefore things become a bit more easier to move.
So I come to see you because I've got some pain somewhere, or I'm struggling to maintain good movement and comfortable movement, and you might look at how I move and
Yes.
how I sit. And
How you stand, first of all, will give me an indication of where there could be a fascial restriction. For me, fascia is very much about following the tissue, not following my head. So it's about looking how the person stands, looking at their movements, where they appear to be restricted, and then just actually, for me, when I put my hands on the person, I can then find, though the tissue will show me where it's tight, and then I can work it from there. Fascia for me is very much about following tissue. So I put my hands on somebody to feel the restriction, and then I'll find where that leads me, rather than thinking that it's coming from there, or there.
so you might end up working
On the
quite
neck.
remotely from the original presenting pain.
I do explain to patients when they come in, if your pain is, because your pain is in the neck, sometimes I might find that the cause of that pain could be coming from somewhere else. So the symptom is presenting in the neck, but the cause could be coming from somewhere else. That's something for me that's part of complementary therapy. So it's just about identifying where you can help that person free the restrictions inside their body so they can move within their own realms of comfortableness.
So it's still very much a physical therapy
Yes.
that you're delivering.
Yes.
But sometimes people would also process things emotionally or psychologically as a result of the sort of treatments that you're doing.
I remember once I had a patient who came in, and she was experiencing really chronic back pain, and there was an acute episode that had come on unexpected, and it was very, very painful, hardly any pressure whatsoever, and so working fascially and doing some cranial sacral releases on certain parts of her were beneficial there. And during that process she said, I haven't felt pain like this since I fell off the stage when I was 16 and I hurt my back. And then I said, tell me a bit more about that. And she told me that she just got up and hadn't told anybody about it. I didn't see any physio, didn't get any help from that. And that was the first time that she experienced that pain. And so interestingly enough, that was her recognition of when that may have started. And there could, in that particular instance, there was a pain protection and guarding going on, even from way back when she was 16. So we went for physio and got her moving so that didn't become a problem later on in her life.
And then once we've helped patients through these restrictions or difficulties, how do you recommend they continue to look after themselves to keep themselves as fit and able as possible?
My recommendations would be to go away and assess themselves, to make sure that they are in a class of some sort, and see how they go. And then if they need some help and they find they stiffen up again, then they can come back and see me, or they can book an appointment in advance, and then they know something is in the diary. I like to leave it to the patient to see how they go, rather than leaving to some strict, regime for them.
So it's about trying to empower them to manage themselves, 100%. But still being a safety net for them
100%,
if they need that.
Yeah, for me that's really important.
Well, thank you for having a chat today. It's always really interesting to talk to you about your work, and I think your passion for it shines through, which is one of the great benefits of having you in Crownfold. I think patients and staff really feel that you're a valuable part of what we do here, and you're kind of the missing link for that. And it's lovely to have the opportunity to talk to you about how much you love your work.
Thank you so much. Thank you.